unpaid. Most people are. I will explain what that is and what that means in a little bit. You may be entitled to New York State paid family leave. I'll go over that. You may be entitled to federal family medical leave. You may be entitled to continuation of health insurance benefits while you're on leave, continuation of other benefits while on leave, and job protection while on leave. And those things seem simple, but you keep hearing me use the maybe because there are exceptions to just about everything. I wanted to spend some time being negative and telling you things that you are not entitled to when you're an adult caregiver, because I think that this is important. You're not entitled to New York State disability benefits because New York State disability is for your illness only. And here is something that happens. So that might make you eventually eligible for disability benefits. The stress of caregiving is incredible, incredible. I know with what little I do for my mom, how I feel about it. So if someone that's a caregiver gets ill, whether it's mentally or physically, then it flips over into you potentially being eligible for New York State disability benefit income. Additional sick time, paid or unpaid, you're not entitled to it by law, but your employer can offer this as optional. And as I mentioned in the first slide, New York paid sick leave, we'll talk a little bit about that. Vacation or personal time, paid or unpaid, your employer can offer it as optional. COVID pay, because you're caring for an at-risk person. At this point in time, as COVID has progressed, COVID pay is for isolation and quarantine only. Used to be for caring for an at-risk person. That is what we call sunsetted, which means it's over with, it's no longer applicable. You're not entitled to reasonable accommodation under the ADA. That is for you only. And you're not entitled to excuses for poor performance. So in other words, that last one, and this is a real tough one, employers expect their employees to keep up their performance level, even if they're not at work in their home doing the most important job in the world, caregiving. So let's go back to some positive things and let's talk a little bit about what you are entitled to from New York State. This paid sick leave from New York State doesn't come from New York State. It comes from your employer's pocket. So in other words, your employer needs to budget and pay to give you time off for certain specific reasons. But before we talk about the reasons, let's talk first about who is eligible for New York paid sick leave. This is a fairly new benefit. It went in, I think, about 2 years ago. It applies to private sector employers only. So if you are an employer like Kimberly is, that works for Onondaga County or a city or a state, this doesn't apply to you. It's for private owned employers only. What you get paid, how you get paid, if you get paid, depends on the size of your employer, meaning the number of employees and sometimes their volume of income. If your employer has 4 or less employees and a net income of less than $1 million, you're entitled to 40 hours off of unpaid, what we call PSL. If they've got 4 or less employees and their net income is more than $1 million, you're entitled to up to 40 hours of paid time off. If they've got 5 to 99 employees, regardless of what their net income is, you're entitled to 40 hours of paid time off. If they have 100 or more employees, you're entitled to 56 hours of paid time off. So how is it decided how much? Because I've said up to. In any 12-month period, your employer has to give you 1 hour of paid sick leave for every 30 hours that you work, up to the maximums. So let's say you've been with your employer for a couple years, and come January 1, that's when your 12-month period starts. They can designate the 12-month period. Every time you work 30 hours, they have to put an hour of sick pay in your bank for you. You work another 30 hours, they put another hour in your bank. Employers can choose to what we call front load that. So they can say to the employee, I'm giving it to you in advance. You're going to get 56 hours this year because we're over 100 employees. I'm going to give it to you as of January 1st. They can do that. They don't have to do that. So let's talk about, and by the way, I know I'm going to go through these slides rather quickly. It's because I want to make sure we have quality time at the end for some case studies. But if I'm too quick for you, stop me, ask a question. So what can we use paid sick leave for? It can be used for adult.
Kathy,
Yes.
I actually have a couple of questions, but sure. I don't know if you want me to interject now, because well, I will just tell you. Okay.
Yeah, go ahead. And if I'm going, Kimberly, if it's something I'm going to be covering a little bit later, I'll say, hold a bit, I'm going to cover it. So go ahead.
Okay. So the question, the one question is, does job protection, I guess that you mentioned earlier, maybe on the earlier screen, does job protection, I guess during leave, but that's not what it says, mean that your exact job will be safe, or maybe they will provide another job at the company? You know what I mean? Is it?
I do. No, I know exactly what you mean.
Okay.
We're going to be talking about job protection for things like PSL, paid family leave, and family medical leave. With job protection for all of those things, they have to either hold your current job open or give you a job that's a carbon copy of it. And the carbon copy is my terminology.
Okay. Perfect.
So that what they can't do is, let's just say you're on a family medical leave for an approved reason. And we'll talk about those approved reasons in a bit. What they can't do is fire you. It's illegal. And they can't say, we can't hold your job open. There are a few exceptions, and we'll discuss those exceptions when we get to that point. Okay, does that work?
Oh, that's fine. The
Okay.
other questions about COVID paid family leave, but I don't know if you're going to cover that more.
Yeah, COVID paid. Tell me what the question is, Kimberly, and let's see.
It says, is COVID paid family leave not available any longer if your child or an adult person that you're caring for has COVID? Basically, you know what I mean? Because it used to
yep. And I can answer that. I know exactly what you mean. I can answer that. And by the way, if y'all see a tail going across the screen, I have 2 cats. No, and I chose not to lock them out of the room because I love them too much to banish them. But here's the deal with COVID leave for caring for somebody with COVID was a federal mandate. It's no longer in effect. However, let's pretend they don't have COVID and that they're just sick. And if they have COVID, they may be sick. If they meet the definition of having a serious illness, then you can have time off to care for them under some of these certain benefits I'm going to be discussing. The reason that they're off, because it's COVID, the reason that they're off doesn't matter. What matters is that if they have a diagnosed serious illness. So bear with me on it. And if by the end of the presentation, I don't answer that fully, let's go back at it.
Okay, thank you.
Okay, so here's what paid sick leave can be used for. Now, keep in mind, I'm going to get rid of this cat. He's bothering me. So keep in mind that the paid sick leave is for reasons that I'm explaining right now that are up on the screen, whether it's COVID related or not. Okay, if the family, and let's go through these and I'll give you some examples. Family member, let's define this first, is an employee's child, spouse, domestic partner, parent, sibling, grandchild, grandparent, and the child or parent of an employee's spouse or domestic partner. Keeping in mind that all of those that I just mentioned could be adults. So if we're talking adult caregiver here, it applies. The parent is the employee's biological foster step or adoptive parent, legal, all that legal mumbo. The child is the biological. And it can be used for any type of medical care, including doctor's appointments. So if your grandmother is sick and she's sick because of she's got a sore knee, or she's sick because she has COVID, and you have to take her to the doctors, you get paid sick leave. You get paid sick time. COVID is the fact that it's COVID is secondary. So if they meet this, the last one you probably can't see it. Can you see this here where I'm pointing with the pointer?
Yes.
Okay, great. Any of these right here can be used for any type of medical care, whether it's related to COVID, mental, or even doctor's appointments. So with that in mind, let's talk about some of the miscellaneous provisions of New York State paid sick leave, which is different than paid family leave, which is different than the family medical leave. Your employer can't make you use a full day. They can allow you to use it in 4-hour increments or less. So in other words, if you've got 20 hours of PSL in your bank, they can elect to let you use 1 hour, 2 hours, 3 hours, 4 hours, but they can't make you use it in a full day. You don't need to give advance notice other than up to 1 minute before your scheduled start time or when you need the time off. But here we go, folks. Be considerate of what needs to be done at work. Do not alienate your employer when you know your mama or your parent or your sister or by the way, sisters and brothers will be covered as of January 1st, 2003. They're not covered yet. But if you know they've got a doctor's appointment, please give as much advance notice to your employer as you can. Even though the law says up to 1 minute before. But here's some information for you. You've got your handouts. I know Kimberly, have you sent those yet?
No, I will send those with the follow-up email.
Yep, when you get your follow-up email, these 2 URLs here that I'm circling, there's information on there. There's more information with regard to New York State paid sick leave. New York State did a great job, and I don't work for the state, I work for myself. They did a great job with some of their information, so do look at that. So let's talk now about PFL. This is New York State paid family leave. New York State paid sick leave is when you are sick or for those other reasons that we said that you can take time off and get paid for. Your employer pays for that. It comes out of their pocket. New York State paid family leave is an insurance. It's an insurance benefit that's mandated by New York State. The insurance company pays the employee. The employer doesn't. What you receive is a percentage of your wages or salary. There's a maximum amount you can receive. I don't know what the maximum amount is. I'm not an insurance company, but I can tell you it's 67% of your wages up to the maximum set forth by New York State. And I'll be giving you information as to how to access that information. The insurance company approves or denies the claims. Your employer doesn't. What your employer can't do, you can go to them and say, I want to file for paid family leave. They can't say to you, no, you can't. They have to let you file because the insurance carrier needs to adjudicate that claim and make the determination. It is for the purpose of caring for a family member who has a serious illness. Okay. Unlike PSL, your grandma doesn't necessarily have to be sick. They might go to the doctor's appointment just for a routine exam and you get that time off. This has to be caring for a family member who has a serious illness. If that serious illness is extended COVID and the person's been sick with COVID for 3 weeks and it's declared by their physician a serious illness, then sure, you can collect New York State paid family leave. Here are the family members that are covered: spouse, domestic partner, parent, child, stepchild, adopted child, foster child, grandchild, grandparent, or the parent of a spouse or domestic partner. So now let's talk about who is eligible. So how do I know if I'm eligible for paid family leave? Employees who have been employed working 20 or more hours a week for a 26-week consecutive period. So you don't have to be what some people consider full-time. You don't have to be full-time in order to be eligible for New York State paid family leave. Employees who have been employed working less than 20 hours a week for at least 174 consecutive days within a 52-week period. These are rules set down by New York State. Your employer has no flexibility on these. And I'll try to clarify when we get to the point where there's some flexibility versus no flexibility. How much leave time do you get? You get up to 12 weeks each 52-week period. That 52-week period could be rolling. So it could start in February. And if somebody takes leave in February, it goes 12 months from there. It could start in March. So it's a roll. It could be a rolling. Your employer gets to define the 52-week period, but it's for everybody the same. So they can't say yours starts January 1st and your coworker starts February 1st. And by the way, just as a little aside, just because I know these things, you have the right to discuss your terms and conditions of employment with your coworkers. Your employer can't tell you not to discuss what you know about your terms and conditions of employment. Your job is to be held open. There's a few exceptions. I can't go over those exceptions for you, but I can give you because they're too varied, but I can give you some examples of how your job is to be held open and what type of jobs would be. For example, if I'm a customer service rep and I do my job as a customer service rep and I'm the only customer service rep that that company has, they still have to give me that time. They still have to hold my job open, or they have to give me a job that's comparable. And Kimberly, this is kind of touching a little bit on what you were talking about holding the job open. Mm-hmm. There's very few exceptions, very few exceptions. If your employer tells you that they can't hold your job open, what I would suggest you do is that you go on the website for New York State and that you call them and talk to them about it. And right here, I've given you a URL that you'll get where the New York State Department of Labor actually holds webinars on paid family leave. Oh. They're very informational. And I believe, I'm 95% sure that you can go on this URL right here and view the past webinars. I think they record them so you can watch them over again. Highly recommend that you, as one of my previous slides said, that you get the information from the horse's mouth, because this is where it comes from. Okay. Any questions on that? Now, next I'm going to be moving on to family medical leave on a federal level, but let me just summarize that we've talked about paid sick leave that comes out of your employer's pocket up to 56 hours for a variety of reasons. The New York State PFL, paid family leave, is an insurance benefit where you get partial income for up to 12 weeks. You get that for more reasons than being an adult caregiver. But I'm here to talk about adult caregiving. That's why I suggest.
We do have a question regarding that.
Sure, go ahead. Absolutely.
So the question is, does this cover caring for a person with Alzheimer's or dementia of any sort?
If it's considered a serious illness by the physician, then yes, it would be.
Okay, good.
But this is why I always recommend, when in doubt, file a claim. You can, by the way, as an employee, you can go on, you could do a Google search. I should have included the URL, but I didn't because I'm trying to focus on adult caregiving specifically. But if you do a Google search on paid family leave New York State and go to their webinar, you will be able to see that you can even fill out your own claim forms from there.
Right.
And turn them in, because here's the process. This is probably going to be helpful. If you get you can ask your employer for the claim forms, or you can get them online. Same type of claim forms. There's a portion you need to fill out where you need to put all your information in about the person you're caring for and the doctor and all of that stuff and what time off you're asking for. And by the way, New York State paid family leave can be intermittent. It doesn't have to be 12 consecutive weeks, day here, day here, day there. So you can fill out the paperwork online for New York State. You give it to your physician. Your physician has a portion that they have, your parent's physician, your adult's physician. They have a portion they have to complete, and then your employer has a portion they have to complete because your employer has to verify your wages and things like that. And there's rules that say it all has to be done within X number of days. So your employer doesn't have a choice. They can't say, I'm not going to do it. They have to fill it out. And you turn that into the insurance carrier, which is different from each employer. They can have different insurance carriers. For example, one might be Shelter Point, one might be another one. I work with Shelter Point, that's why I mentioned them. So yes, it could be Alzheimer's if it's declared that you are the assigned caregiver and that person has a serious illness and can't take care of themselves. Does that help?
I hope so.
Okay, great. Great. So, okay.
Say if it did or not.
Yeah, so we, New York State paid family leave, as far as job protection, as we say here, your job will be held open with a few exceptions. I can't think of any exceptions off the top of my head, but I always say few exceptions because there's exceptions to almost every rule. And when we get to FMLA, which is next, you'll see a little bit about what I mean about an exception I can define. So let's continue on to FMLA. FMLA is available. This is federal. It's unpaid leave. It's available to employees of private employers who have 50 or more employees within a 75-mile radius. It's available to employees of public employers of any size. And I don't make these rules. I just try to explain them. It is unpaid. So you're getting time off that's unpaid. And the reason, so employees might be saying, oh, so then what do I get if I'm, if it's unpaid? Well, what you get is job protection. What you get is benefits continuation, which we'll talk about in a minute. The employee must have worked for their company for a certain period of time. In a 7-year period, they have to have worked for 12 months, and they have to have worked for at least 1,250 hours in the last 12 months. So if you're a brand new employee with your employer and you haven't worked that many hours in 12 months, you are not entitled to family medical leave. They can have, and employees can have up to 12 weeks of unpaid leave. And the reason that they can have time off is to care for a serious health condition as defined by law and documented by a physician. So we can't just pop on, we can't just pop online and file a claim and say, I want time off. It has to be a serious health condition as defined by the law, and the physician has to document it. You can use it to care for a family member, which includes spouse or domestic partner, parent, and parent could be biological, adoptive, step or foster, or any other individual who stood in loco parentis when the employee was a son or daughter, is indicated in the definition of son or daughter. And below you see the definition of son or daughter. Your job is held open. So do you get fired if you're still out after 12 weeks? These are a couple questions and a couple of things I'm going to explain right now. The few exceptions is in FMLA is there is an exception in the law that says if you are declared a key employee, that your job does not need to be held open. But that doesn't mean they can fire you, because they can't. It's difficult for me to explain to you what a key employee is because it depends on salary levels per employer. It depends on how many high-level salary people your employer has. But I can tell you that there's a lot of positions that probably wouldn't qualify. I'm going back to my customer service example I used a little bit ago. there's 10 customer service people, and no matter how important customer service is, and it is, no way could, and this is my opinion here, no way could that employer justify not holding your position open because somebody could probably pinch hit for you when you were out. So we look at many different factors when we decide, can we hold this job open? Can somebody else do the job? Is it reasonable? Will it cause, in the case of FMLA, will it cause a hardship for the organization to hold the job open? I'm going to give you an example of an actual situation that just happened this past week with a client of mine. Their HR person called me and we discussed it. They had a production manager's job. It's a manufacturing facility production manager. In the company, the hot shots in the company, the big shots, they said, no way, we can't hold this job open. We can't hold the job open. And the HR person and I agreed that you can have a supervisor fill it part-time. You can have somebody else. You can't classify that as a key employee, no matter how important it is, because you've got other people that could step in a pinch. So there's multiple factors that go into the key employee for FMLA. In paid family leave, which we just talked about, there is no key employee factor. So your employer can't say to you, you're a key employee, I can't hold this job open. There would be, as I said, very few exceptions, if any, to not being able to grant and hold the job open. You'd have to look back as to the qualifications and qualifying for that leave in the first place. So let me tie a couple things together now. I want to tie together PSL, PFL, and FMLA. Maybe this will give you a little bit of a better idea of how they work together. They can all run concurrently. And I'll try to give you some examples of this. Sometimes you can be on PFL, FMLA, and collect PSL pay. So think of roads running concurrently. We start here. PFL starts here, FMLA starts here, and they run side by side. So you're eating up your 12 weeks of PFL time, you're eating up your 12 weeks of FMLA time concurrently. And again, I'm talking about this as it relates to caregiver. If you're talking of pregnancy, caring for baby bonding, that's different. We don't have time to go there tonight. That's different. So you could, for example, be caring for a parent with Alzheimer's, and the doctor has declared the person seriously ill, totally disabled. They can't take care of themselves. They need the care that you give them, and the doctor has verified that. You have filed for PFL through the insurance carrier. They have approved it. So your employer puts you on FMLA and PFL together. So you're eating up that 12 weeks, and now you've got your job protection unless you're a key employee. You might have some PSL in your bank for the sake of a hypothetical situation. Let's say that you've got 40 hours of PSL in your bank. So for your first 5 days of leave, you're collecting full pay. Then your pay drops down for the remaining 11 weeks, drops down to PFL income only, which is a percentage of your pay. And by the way, on the New York State site for PFL, paid family leave, there is a calculator that you can run through and calculate how much you would actually get in a check from the insurance carrier. PFL for New York State and FMLA federal don't supersede each other. It's a misconception that many people have, that whatever is federal is better and you get that instead. They don't supersede each other. As I said, they can run alongside each other. If you don't, for some reason, qualify for PFL, paid family leave, but you qualify for FMLA, you can still use PSL under certain circumstances under paid family leave. And by the way, a big thing I forgot to mention, your employers are required to have written policies on all three of these. Written policies, PSL, PFL, FMLA. If your employer does not have an employee handbook, which they don't need to by law, they're still required to have written policies for all three of these, which comply with the law. You can also use PSL. Well, collecting PFL, we mentioned that, not to exceed 100% of your normal wage. So I've said to you that PFL is a percentage of your salary. So let's say you're collecting 67% of your salary on PFL. You can't say, okay, now I want 100% of my PSL, so I want 167%. Just 100% of your normal wage. And keep in mind that the amount of PSL you have accrued is limited, up to 40 hours, up to 56 hours. Any questions on that? Because my next topic I'm going to move on to, I'm going to move off of PSL, PFL, FMLA, and move on to caregiver discrimination laws and some guidance that protects you. So let's move on to that. New York State Division of Human Rights gives you protection with regard to discrimination. That discrimination extends to,
Kathy,
yes, sure.
I'm sorry.
No, don't apologize. Don't apologize. Go ahead.
There is a question, because I'm
Sure.
really excited to go on to the next step. It says, you've referred to insurance covering some aspects of leave. Would you please clarify whose insurance and what this means? I'm assuming that means with.
Yeah, absolutely. I know just,
right?
yeah, I know just what they're asking. FMLA is not an insurance. It's
Right.
only time off, you get no income. PFL, paid family leave. PFL, paid family leave, is a mandatory insurance benefit. You know how, and people probably can recall this, you've had coworkers who've gone out on disability benefits. They're disabled, they fall, they're sick, they go out on disability. That's an insurance that New York State says, as an employer, you need to carry. It's like New York State saying to you, you need to carry homeowners insurance. You need to carry car insurance. It's mandatory benefit your employer has to sign up for, and there's a premium that's paid for that. Your employer can pass that premium on to you and say, okay, employee, you're paying for this PSL insurance. So it's an insurance benefit that you file a claim and receive payment directly from the insurance company. Kimberly, do you think that answers that one?
I hope so. Caroline, you can let me know if it didn't.
Yep.
But I know, yes, she said yes.
Okay.
And
great.
I know I'm paying every,
Right.
and I know there's a limit. If you don't pay much, I think it's
Right.
$43 a year or something like that.
Yeah. Yeah. Every paycheck, it comes
Yeah.
out of every paycheck.
Right. In New York
Yeah.
State. Right.
Yeah. Your employer can elect to pay that premium for you. I don't know any employers. I don't know any employers that do.
Yeah. I'm sorry for laughing, but yeah.
Yeah, that's okay. No problem. They can pay it. I try to tell people what they can and can't do and what isn't optional. So the protections that you have, these are the laws that protect you. New York State Division of Human Rights, discrimination. Discrimination is not just, people have a misconception that it could be just race or age or things like that. It's disability too. It's do you have a disability, or are they discriminating against you because you are taking care of somebody? Something else, just as an FYI for everybody, that your employer in New York State has to have. They have to have a sexual harassment discrimination policy. Sexual harassment doesn't mean sex. It doesn't mean sexual intimacy. Sexual harassment is harassment because of someone's protected class, gender included. So in other words, if you're a male and your employer gave PFL to all the females and wouldn't give it to you, that's gender discrimination under New York State Division of Human Rights. New York State denial of mandatory benefits. Your employer can't deny you these benefits. They can't say you don't have it, we don't carry it. It's mandatory for them as an employer under the conditions I described to carry it. U.S. Department of Labor, denial of mandatory benefits right here, FMLA. U.S. Department of Labor on a United States federal level says you can't deny FMLA benefits. You can't deny covering people under FMLA, but be very careful of misinterpreting that, because if you look at the FMLA policy or you look at the FMLA laws online, only look at them. Here, word of caution, folks. Do not Google them and read somebody's blog. Go right to Department of Labor websites, both on a state and federal level. There's too many misconceptions by others out there. So under FMLA, they can't deny you for it if you qualify under the rules and regulations, including service credits. But by the way, with FMLA, if your employer denies it, they have to give that to you in writing. The EEOC, Equal Employment Opportunity Commission, on a federal level, they oversee, they're part of the Department of Labor, but they oversee associated discrimination, including caregivers association with the individual receiving care. So if your employer is discriminating against you because you're a caregiver, even if they say things, and employers hate me for this, I'm an employer's worst enemy and best friend. If the employer said, if you're caring for your employment or your aging parent, something that would be considered discrimination would be them making derogatory comments to you about it. You know, what are you doing taking time off? You know, we need you here at work. Even something as innocent as that. If you're getting comments like that from your employer, here's one of the things you need to do. You need to have the gumption to stand up to them and say, you can't say that to me, it's inappropriate, because they can't say it to you. Okay, let's talk, those are the laws, okay? Protection under the laws. Let's talk about continuation of benefits, because I know this is really important for some people. Let's talk about the things that your employer has to continue for you if you're enrolled in these insurances. Your health insurance, the employer must continue while on leave. That includes paid family leave and the Family Medical Leave Act. So FMLA and paid family leave. You pay at the same rate you paid while you were active. So if you are on your 12 weeks, let's say you take, whether it's 12 weeks consecutive or intermittent, you're on your leave for 12 weeks. If you were paying a premium of $100 a week before you went on leave, and you continue to pay that same premium while you're on leave, your employer has to continue the insurance. Be aware that if you don't pay the premium on time, the employer can cancel your insurance. So this is an obligation on your part, just like a mortgage would be, just like your car insurance would be, just like your homeowner's insurance would be. It's a financial obligation, but you pay the same rate. They can't say to you while on leave, when your leave is up, if they let you stay out longer, they can say, okay, now you've got to pay 100%. In fact, with FMLA, if they continue it on, they can tell you that you have to pay 100%, or they can put you on COBRA, which is continuation of benefits under law, and they can charge 102% then. Other insurances, continuation provisions are available. I can't cover them all for you, and I'm sorry, because I don't know what your employer offers. But I can give you some examples. Let's say you're being covered on, you carry the dental insurance for your family. That would be covered under benefits. If you carry vision insurance for your family, that would be covered. So if anybody has any questions on a specific insurance or benefit, I'd be happy to give you information on that. So just ask and Kimberly will give me the question. PSL, here's a couple little facts. Employers cannot make you use it, but you can if you want. So if you were to go on PFL and you said, I want to save my paid sick leave because I know when I'm done with PFL, my mother is going to need follow-up doctor's appointments and I'd like to get paid for that, you can save your time. They can't make you use it. Employers can make you use other paid time off, such as vacation, PTO, or personal. So if your employer is one that offers you vacation time, when you go on FMLA or PFL, they can say, you've got to use your vacation time. When you go on not PFL, FMLA, because when you go on FMLA, remember that it's unpaid. So they can say, well, you've got 2 weeks vacation, so we want you to eat up that time while you're off unpaid. I want to talk a little bit next. I'm done. And Kimberly, if there's any questions on these benefits, next I'm going to be talking about additional benefits an employer might offer. Unpaid time off, work at home, part-time work. If you're a salaried exempt employee, can you work part-time without jeopardizing your exemption status? Quick lesson. There's certain salary thresholds that need to be met in order to be legally qualified as an exempt employee. So it's not based on part-time or full-time. It's based on how much you are paid. So that's an important thing to discuss with your employer because it depends on what type of a job that you're in. So your employer can, however, if you don't qualify, if you're an exempt salaried employee and you don't qualify to continue to be exempt and still work part-time, your employer can switch you to hourly under those circumstances. Your employer might offer flex time. They don't have to. They might be able to offer part-time work at home, part-time work in the office. They might be able to offer you, hey, you can leave at noon. You can come in early. A lot of it depends on your job. If you're a customer service, I keep using customer service because those types of jobs are in so many different types of businesses. If you're in customer service and you need to offer that service in person, you can't work at home. If you're in customer service, I've got clients that do customer service, but it's all over the phone, then you might be able to work at home. Let's talk a little bit about, did you have a question? Sure.
Yeah, I have a question.
Sure.
Okay. If PSL is included, okay, I'm not sure about this. If PSL is included in PTO, PSL is not protected, right?
I know just what they're talking about there.
Good.
Yes, it is protected.
Okay.
Yeah, that's a mistake. And it would be too involved to try to go through it all. But the mistake I've seen employers make is they need to remember it's legal to combine your PTO and PSL policy. You can combine it, but you still have to comply with the PSL law in doing so. And I've not seen one policy yet that does that effectively. So keep in mind what we said, that you are entitled to certain protections. And one of those protections is PSL pay. And regardless of how your employer disguises it as PTO, you are entitled to all the protections afforded under PSL, paid sick leave from New York State. So they can't, so let me try to give a hypothetical example because I've seen employers try to do this one. And I don't think they're trying to be malicious. I think they're just trying to make it easier on themselves, which it's not. I've seen employers combine the two policies and then say, okay, you've got to give us advance notice. You've got to give us 2 days advance notice. Can't do that if you're offering PSL. I'm very certain of that. So I hope that it probably doesn't make the individual that ask the question happy, but at least they understand now what the protection is for that.
Okay. Thank you.
So you're welcome. So let's talk about unpaid time off considerations. And by the way, we're probably going to run over. I'm okay staying on, Kimberly. I'm okay staying on for people that want to stay on for a bit. If I need to go, I'll tell you. Unpaid time off considerations. Can you afford to have your salary reduced? You know, it's just some kind of personal things to think about. It doesn't cost your employer anything, or does it? In many cases, whatever happens, it costs your employer. They're not getting your full production. You worked 40 hours a week before. You gave them 100%. You gave them their pound. You gave them their pound of work. And if you're not there to give them their pound of work, somebody else has to do it. So if they have someone else do it, do they have to pay overtime? If you're earning $20 an hour and you're only giving them half of that, half time, and they're having to pay somebody who does the same job $30 an hour to do your job, it's costing them extra money. So a lot of employers look at their bottom line. I'm not justifying it. I'm saying that's what they do. Are they still paying your full benefit amount, but not getting the work out of you? Benefit amount, I mean, if you're only working half-time and they're paying your full premium for your insurance, your health insurance, or part of they're paying the same premium they paid when you were working full-time. So just some considerations. Some work at home considerations. Can the job effectively be done at home? Only you and your employer can answer that. Now, obviously, something like a nurse can't be. Obviously, something like a telephone customer service person could be, because look what I've said here. What about equipment, phones, computers? Your employer doesn't have to provide it. They could say, sure, you can work at home if you have equipment that meets our standards. Are you really working at home? Here's the challenge, folks. I hear this so many times from my clients. Are you really working at home, or are you in adult care setting while working? There's a difference. We have the same thing with childcare. My employers have the same challenge with childcare. Well, my employee tells me that they have to work at home because they can't get daycare. Not an employer's problem getting the work done is. Unfortunately, and personally, sadly, it's the same thing with adult care. Big important thing, are you disciplined enough? I've had my own business for 21 years and I work out of my home, which doesn't mean I work at home all the time. Sometimes I'm on a client's site. I worked at home more during COVID, but this is huge, being disciplined enough. I could do a whole seminar on how to work at home. Let's talk about part-time work considerations. Is your job one of a kind? And if so, who will do the work when you're not there? These are questions to ask yourself, and that your employer is certainly asking themselves. If your job is a multi-incumbent position, the chances of working part-time are greater because your employer could hire 2 part-timers instead of having you full-time. Easier said than done. It's hard to get employees these days. Sometimes it's hard to get part-time employees. So if you're customer service, or if you're a manager, could your employer replace you with 2 part-time employees? Can you afford financially to work part-time? I can't answer that question. It's just a consideration. Are you a supervisor or a manager? And if so, what impact will your, I should have said working part-time. Sorry, this is wrong right here. What impact will your working part-time have on employees you supervise? Some flex time considerations. Does your job have to be done during certain hours? I'll give you an example of my job. One of the things I do is I do training for employers, whether it's online or in person. I can't dictate when that's done, my client does. But when I'm writing an employee handbook for one of my clients, I can do that at night as well as I can do it on a weekend. Or does the job just have to be done and it doesn't matter when that happens, like the employee handbooks I write? Is it possible to change flex start or end times? Is it possible to go home at lunch and take extra time? Keeping in mind that you can use things like PSL intermittently. You can't use partial days of PFL, paid family leave. I'd be remiss if I didn't talk about what your ethical responsibilities were, or what Kathy Barony thinks your ethical responsibilities are. Getting the job done that you were hired for. Working the schedule you were hired to do. And yes, employers have a legal right to change your schedule. Or flex time. If flex time, are you still giving it 100%? Work is work, personal is personal. Can you keep them separate? It's much easier said than done. And are you doing what you want to do to make it easy on you, or are you doing what you need to do? Just things to consider. Challenges for you personally to challenge yourself.
Well, that's a really good question.
Yeah, it's huge,
Yeah.
huge. Approaching an employer, what not to say or do. I'm using the negative here first, folks. Sorry. Is there a possibility that, should you say that? Sure, because you're being nice. You're not demanding. Is there a possibility that I can take time off? Say something like that. If I understand the employee handbook correctly, I may be able to. If you have an employee handbook, look at that first. I can guarantee you my next month's supply of chocolate, and I have it every day, that your employer doesn't even know sometimes what's in the employee handbook. They write them, they put them on a shelf. So check your handbook. It should be a great resource. Be prepared to solve or offer solutions for the employer's problem that your absence might create. Hey, you know, I need to take Friday afternoons off, but I can rearrange what I get done and do it for you Saturday morning. It's hard to turn somebody down when they come into with a solution. Predict your future needs as much as you can. Easier said than done. But if you know how much time off you might need, share that with your employer. I think I might need 2 to 3 weeks, or my mom's got Alzheimer's and she's doing worse, so I'm going to need my full 12 weeks. You know, do some what happens if type of things. Are you the only potential caregiver? Be sure they know that. If you are the only potential caregiver, you have more rights, because some of the questions that could be asked for FMLA, for example, is, are you primary caregiver? And make sure your employer knows that if you are. I look at my case. I have a sister. She doesn't help sometimes as much as I do. She thinks I'm more flexible because I own my own business. But she's both, we have 2 of us. If push comes to shove, we have 2 of us. So keep that in mind. I want to talk about some negatives, some things not to do. Don't demand, ask nicely. My mom always said, and she still does, you get more bees with honey than you do with blank. Guess what that might be? Ask, don't tell them. One thing that I can guarantee you gets an employer's hackles up. When an employee goes to an employer and says, I'm taking time off, I'm entitled. Our policy says I'm entitled to this, so you need to give it to me. Niceness. Don't say, I don't know how much time off I will need. Sometimes you don't know, so tell them why. Be transparent. Be transparent and guess as close as you can. How about this one? I'm going to the labor department. You can. You have a right. You have a right to go to labor department anytime you want. But what could you say instead? Think of an option, because that's one thing employers get defensive over. And my big one, folks, don't ever lie. That's a Kathy Barony. So how do we balance this? We're almost done. And then for those that want to stay, I'll talk about some actual case studies. We're almost done. How do we balance this? It's about time. Do you have the time? Do you have to create the time? Can you engage assistance? How much time are you willing to put into it? Today's a prime example. I'm self-employed. I've mentioned that. I started work at 7 this morning. I worked for about 15 minutes and then I took off to my mom's. I had coffee with her. I took her cat to the vet's. I came back. I worked the rest of the afternoon. I'm working right now. It's volunteer, but I'm working right now. I chose to do that. I could have taken a couple hours off this afternoon to sit on the deck. I had assignments I wanted to get done because I'm on vacation next week. Not everybody has that flexibility. So think about it. Is it about money? Is it about money? Can you afford to work less? Can you afford to have less benefits? What are your priorities? I'm fortunate. I thank the good Lord. I've had a successful business. I can afford to work less. My choice to continue to work is mine. You all probably don't have that luxury. Can you afford to hire help? What priorities need to be set? And the bottom line is, what's most important? Did you become a caregiver because their life is worthy of your time? I think that that's really important. Any questions before we talk about some case studies? Kimberly, do you have anything?
Nothing in chat.
Okay, so I'm going to take a couple minutes, and whoever wants to stay is welcome to. I'm going to stay. I'm going to take a couple minutes to go over some case studies, and I'm going to read from my case studies here. Here's one in this person's actual words. I work as a professor at a college in New York State. I was privileged to be able to have the opportunity to work remotely as a result of the COVID pandemic. It was also during this time that I became a sole caregiver for one of my parents. Aside from being over 65 years old, My parent also has physical and mental conditions that are classified as high risk for complications from COVID. Now, keep in mind what we talked about here with regard to COVID and sickness. This person happens to be high risk. It happens to be because of COVID, but the bottom line is that they have physical and mental conditions. After much thought, I asked my direct supervisor to approve continued remote work. The supervisor consulted with our dean, who directed me to another unit at the college. However, after speaking with one of the directors of that unit, I was told their office could not offer me help. They suggested I talk with the Human Resources office. Good old Human Resources. I can say that I was Human Resources. I still am Human Resources. So Human Resources is supposed to be the end-all cure-all of an organization, right? That they can find the right answers. The dean, however, the pattern continued as the Human Resources staff member shared that they could not assist me because I hold a faculty, not a staff position. I will say that faculty members in higher educational institutions fall under some different rules than some of the other employees. However, in my opinion, as an HR person, HR should be a helper and have found the answer for them. That's just Kathy Barony's opinion. The pattern continued as the HR staff member shared they could not assist me because I hold the faculty position. I went back to the dean again, who tried to find the proper channel for me. The dean assured me that this third office was in fact the correct unit to not handle concerns like mine. After being bounced around multiple offices, I returned to the dean to make my request yet again. The dean indicated that flexibility could be offered and at the same time astounded at the lack of an intentional and clear process. No, I missed a word. While I am grateful for the result, and at the same time astounded at the lack of an intentional and clear process for people like me and for families like mine, I have come to believe it was only through the kindness of random strangers, as well as my patient and tenacious advocacy, that I was successful, and that this is a very scary realization. How many others are left abandoned by the systems that do not care about them as people, as human beings who require protection and consideration to live healthy lives? And I titled that case Lack of a System and Policies. I really think that was the problem. And you will find that many of your employers have the same situation, that you just can't get a clear answer from somebody. However, let me talk about what this person might have been entitled to by the law. My HR hat is on now, not my compassionate Kathy hat. By law, after the federal mandate disappeared of being able to take time to stay home with someone, there was no protection for this. There was no protection because this says high risk. Now, if the parents needed care and had a serious illness, there would be protection. So see the fine line between legal protection and what this individual here said about caring human beings. Mm-hmm. I wish I could answer the question about your companies and how caring they should be. That's up to each individual company. Mm-hmm. Did you have a question, Kimberly, on that one?
Oh, no, sorry. I should be on mute. I'm just humming.
No problem. I just don't want to miss it. I know I talk and you just have to just stop me. Here's another one. I was not a caregiver when COVID began, but worked from home remotely for nearly 1.5 years. When asked to return to in-person work, I asked my supervisor if I could continue to work from home, at least temporarily, until I could find suitable care for my mom. Caregivers are hard to come by due to COVID, as well as making appropriate safe arrangements could take some time. I was passed around the administration for a week or so with no answer, and then sent to HR. HR told me I could apply for New York State Paid Family Leave, PFL, and continue to work for home. And bear with me because I'm going back to that. Very strange that HR did not realize that PFL meant that the employee was out of work and not a work from home benefit. However, I did do this for a while until I was able to get my mom situated with care while I was at work. You can't collect PFL and work at home. HR was wrong. 100, I'm 100% certain of that, because keep in mind that PFL is a mandated benefit that an insurance carrier approves and says, okay, you can't work because you're caring for somebody at home. However, what would be required in that case is that the PFL claim forms would need to be filled out. Insurance company reviews it, says, yep, we've got the proper doctor's notes. You need to be the caregiver for this person. So the bottom line is this person was protected under PFL. And if they worked at home on top of collecting PFL, their employer couldn't mandate that.
But they did.
But I'm assuming
They
Kimberly,
did. I know the case. They
okay.
did.
So
they said work, and she did.
Yeah, and she didn't have to.
She didn't know that either,
Yeah.
her rights, but
Yeah, and they don't. People don't. And here's what else happens. I've seen this with disabilities, especially in cases of pregnant women and caregivers. Okay, I'm healthy. I can work. So therefore, I'll take phone calls. I'll work at home. And they do, but they don't have to when they're collecting benefits, nor can the employer insist that they do. Now, let's pretend, for hypothetical reasons, this person was not eligible for PFL, for whatever reason, but they're still a caregiver. The employer can then insist that they come into the office, or the employer can let them work at home like the employer had in this case for the past year and a half. Recall what I said, as cold-hearted as it sounded, that working at home is not caregiving or child sitting at the same time. So the employer could have said, you can't care for your parents. You have to come in the office, or if you're to work at home, you have to work at home 100%. You can't care while working at home. That's the sad truth. This one, oh, by the way, going back to the last one, I don't know what size that employer was, but if the employer was of the size and met the qualifications to have FMLA, the person could have had FMLA concurrently with both of those, with the PFL, which would have been job protection.
Yeah.
Part-time and PFL remote work is I entitled the next one. I was a caregiver for both parents when COVID began, but at the time, my mother, who was an amputee, had the cognitive ability to look after my father while I was at work. During COVID, Mom passed away. My father had COVID, was hospitalized and recovered, but his dementia accelerated to a degree that he cannot be left alone for long periods of time. I tried to apply for Medicaid to have home health care, but was denied and cannot afford home care on my salary. When my employer requested that I return to in-person work, they gave me the option to apply for part-time intermittent PFL and work from home 2 days a week, which I did until the PFL time was used up. Remember, we said you've got 12 weeks, and so you can use that up in day increments. My understanding was PFL time would refresh with each year, and she should qualify again, but maybe you can help clarify that. Kimberly, I believe that was your question.
Yes, that was my question.
Yeah.
When did it refresh? But that, yeah.
Yep. The year is a 12-month period. So keep that in mind when doing calculations of what a person might be eligible for.
But does that 12-month period end with the end? So she took 12 weeks in 2021. Does the year start again at the end? So if she stopped, if her 12 weeks ended in November, let's say, is she not eligible again until November 2022?
It depends on the employer's 12-month period. And it depends on the insurance company if they consider that the same serious illness to care for. That's the insurance company's call. And that's a tough one.
Yeah. Okay.
Yeah.
Okay.
So I asked my employer if I could continue to work part-time in person and from home part-time. They declined. but then eventually did offer me another part-time position in a job that was a demotion. This person refused. So yeah, the employer, once your PFL protection is up, once your job protection is up, they don't have to hold that job open. They didn't have to offer her the part-time position, but they can. I spoke with my doctor and received a referral for disability, which my employer was paying. Employers don't pay disability, the insurance company pays it. And I'm assuming that this, the disability that the employee applied for was for her own disability because she was then sick. She would have to be.
Yeah.
She would have to be in order to get disability. However, at this point, the employer had stopped contacting her, but refused to fire her. And the employee refuses to quit. So the person's in limbo. And yeah, the person is in limbo because the employer is not, in my opinion, the employer is probably not firing her because they don't want to be accused of discriminating and because the person might have a medical condition. So they're leaving this person in limbo. And how long can they leave this person in limbo? Probably as long as they want, but there's things I don't know that I couldn't solve this case with, that I would need more information. I'd need to know about benefits, continuation, what was said, what was in writing. So the cases are not black and white. Cases like this one, Kimberly, are not black and white. Let's see. I've got one more case that I'll do, and then I'll stay if people want to ask questions or give hypotheticals. My title to this case was, can they do that? This happened with one of my clients. When COVID started, I was a caregiver to an at-risk parent. Almost my entire office was assigned to work at home. So I was able to work from my mother's house and take care of her. I got paid my regular salary and just kept producing the work. My employer didn't complain. After several months, some employees started to go back to work in the office. I didn't know if they did that because my employer made them or if they wanted to work in the office on their own. So I continued to work at home, take care of mom, and nobody complained. Forward a few more months, I was still working at home and taking care of mom. I knew some of my coworkers were going back to the office and knew some were still working from home. I got an email from work laying down some demands. I needed to be available at specific times during the day for virtual meetings and had to go into the office periodically for other events. I missed some of those times, some of the meetings and other events, and now all of a sudden I'm told I'm not performing well and I'm being put on a written warning. Can they do that? Yes, they can. Wow. Because they need, this person's obligation is to uphold performance standards. So that's my formal presentation. Sorry that we ran over a little bit. I'm more than happy to stay on if people have other questions, or Kimberly, if there's something you think that I should continue to explain.
Okay, let's give you a second. Anyone have questions or comments before I do? Well, one thing I was wondering, Kathy, is if you're seeing more and more cases like this because of COVID. So in each of the cases, in each of the scenarios that you gave, these people, number one, were successfully working home for almost 2 years. Number two, COVID is still a concern for caregivers, bringing, you know, so is this something you're seeing a lot of? Is this something that employers will be looking at? Oh gosh, well, I shouldn't say that's too broad, but legal protections, maybe policies that you're aware of, either on the federal or state level, that can help with these situations?
Yeah, I'm not aware of any coming down the pike. Let's handle the easy part first, the policies coming down the pike.
Yeah.
What I am aware of, both from my own clients and fellow HR people that I network with, is that employers are getting a little disgusted with not having people in the office. Some employers, it's so it depends on the employer, because what I've heard, and I feel their pain, I feel the employer's pain. They're saying that some of their employees are getting disconnected from teamwork, disconnected from group effort, disconnected from the company. How can we part of it? How can we be part of a group? How can we be a team when we don't see each other and we only see each other on Zoom meetings? They're getting zoomed out type of thing.
Yeah.
So if the employer's culture is that they're touchy, feely, culturally, emotionally, then they're feeling some pain. I've seen other employers who it's not important that the employees interact with each other. And employers are embracing it and saying, it's saving me money. I don't have to have office space. So it depends on the type, in my opinion, in my experience, what I've seen, it depends on the type of business that it is. So one of the things and I hate to say this to people, but I will. And one of the things I think people should look at is if you need to change jobs and find an employer whose culture and whose business supports. Keep in mind that the employer's first responsibility is their bottom line, unfortunately, sometimes. So if there's an employer who offers a type of job that can be effectively worked at home, that's hitting pay dirt. It's hitting pay dirt. And I've had people, I used to do career counseling too, and I stopped it. Thank you, Lord. It was very tough. But I still have people come to me and say, well, I'm going to do a work at home job. All right. So what are you qualified to do at home? Think about what you're qualified to do at home and what jobs would provide that for you. I think it depends too. One of the things I've seen in general, and I'm stereotyping, openly admit I'm stereotyping, I see nonprofit organizations being a little bit more humanistic about it because of the audience that they serve. Mm-hmm. So I think that they can be a little bit more flexible, yet many of the nonprofit world has to do their work in person. Sure, if you're a case manager, you can do that from home as well as you can from an office. But keep in mind, a lot of human services organizations have to be out there with the public. So yeah, Kimberly, I wish I could give you some more specifics about what's coming down the pike, but I can't.
Yeah, well, having worked a lot in legislative advocacy, I would say I certainly keep my eye on what's going on in terms of federal and state policy regarding caregivers, because it's a big topic that's coming up now. I mean, I see more and more and more articles and push for policies to be put in place for caregivers, specifically because of COVID. So I mean, because COVID meant, created an atmosphere where people could work from home, and COVID also created an atmosphere of fear and concern, and it still remains. So I will keep an eye on that. And if there's any advocacy opportunities or ways that any of you working caregivers can add your voice, we'll certainly make that be known to you all. I'll send out an email, because I do that from time to time, just to be able to add your voice to it, because it's really like the first case that you discussed, where she was successful, but really saying, holy cow, really, is there no policy in place for this? Is there no, what happens when, the government says, okay, COVID's over, but my mom is really in a bad position. I need to, I need not to be in the public arena every day and, be concerned. So yeah, it's really something.
Yeah. And I agree. I think that COVID was an awakening.
Yeah.
And I'm not sure some employers are coming around to that awakening, yet I know others are. I've had my own cousin works for an organization that's well known in Syracuse. They'll stay private, but her organization has had COVID run through there, and they've been more than generous with letting people work at home. More than generous, and so they're a for-profit organization. They're a big name for-profit organization. So it's so much depends, but Kimberly, I can't say it enough and second your thought about people need to get out and advocate for things they care about. And I say the same thing to my employers when they complain, oh, the laws, we got to do this for employees, we got to do that for employees. I'm like, when's the last time you talked to your congressman or your congressperson? Advocacy is important. Yeah.
And there are some grassroots organizations that are starting to push on this, so that's good. And Caroline posted the EEOC the information about employment discrimination against caregivers. And you had
Right.
referenced that earlier in the class, right? When you were
Right.
talking about the,
Right.
and I know I read through it. I can't remember all of the protections that it has. Unfortunately, it doesn't provide protection in terms of allowing you to work from home, but it's a good start. I was very excited when I saw it.
Yeah, I was there. There's the laws that we talked about, some of the laws, and those laws go deep. So I guess we're good to go then.
I think I'll leave that. I think I will put that, Caroline, that link in the follow-up email for other caregivers who
Sure.
who didn't see this. So thanks, Caroline, for that, reminding me. And I'll include that. So anyway, a really, really important topic, Kathy. I just can't thank you enough for taking the time.
Oh, my pleasure.
I'm very excited to be able to do this. And, as things change and progress in the future, maybe we can have you back. And I just, your expertise and your time, I know is so valuable, and we really appreciate you spending your time with us. And thank you to everyone who was here.
Absolutely.
I hope it was really beneficial to everyone. I'll be sending out a follow-up email. If not tomorrow, then definitely Monday. But look for it with the PowerPoint presentation and any other links that might be, of benefit to you. Okay.
Absolutely.
And also, I forgot to say this, Kathy, because Kathy told me before the class started that should any of you actually have questions that you think of after the class, you can email me. And then Kathy said she would actually address them. So, thank you, Kathy.
You're most welcome. I'm going to go ahead and sign off now. Everybody have a great night, and
Good night,
I wish you the best of luck.
Yeah.
Hug your parents and tell them you love them every single day. Have a good
Oh,
night.
thank you. Good
Bye.
night.